Hey folks, welcome to Diving In This Week, Episode 4, Quarantine Edition. Now I know everyone's talking about coronavirus, but I gotta do it too. So this episode is gonna focus on coronavirus, what's happening around the world, how we can flatten the curve, and breaking down some of the myths. So whenever a major thing happens in the world, such as this pandemic, some people either take it too lightly or take it too severely. This is the former.
If I get corona, I get corona. At the end of the day, I'm not going to let it stop me from partying.
Now, he later apologized on social media because he was hit by a lot of scrutiny on Twitter as well as on Reddit. This is what he said. I'd like to take this time to own up to the mistakes I've made and apologize to the people I've offended. Like many others, I have other people who I adore more than anything in the world and other family members who are at risk. Our generation may feel invincible like I did when I commented, but we have a responsibility to listen and follow the recommendations in our communities. Now it's for you folks to decide whether his apology was sincere or not. Personally, for me, I don't think it was. Now for the next one, I personally feel very disgusted. Now we all know the things that are happening at grocery stores. Long lines, social and physical distancing while purchasing, but this person takes it to a whole new level. Take a look.
It went viral and it shows him licking toiletries in a Missouri Walmart while saying, "Who's afraid of coronavirus?" Wow, dude, you're so cool. The 26-year-old has now been charged, thank goodness. But get this, the charge is with making a terrorist threat. He's not only the only man to be facing charges for putting the public at risk. Two men, one in Jersey, New Jersey, and another in Pennsylvania, have been charged with coughing on others in grocery stores. So the two men allegedly coughed on individuals and then claimed to have the coronavirus. They are also facing charges including terroristic threats, obstruction, and harassment.
Now these kinds of acts are very disgusting, sneezing on other people. I feel like at this time we should stick together and bring this pandemic to an end. Now this is what it has led to. The Deputy General Jeffrey Rosen actually gave a statement where he actually talks about how this can be a terrorist threat. Take a look.
Anyone who threatens or attempts to spread the coronavirus could be charged with terrorism. That's according to a Justice Department memo obtained by multiple news outlets. In it, Deputy Attorney General Jeffrey Rosen wrote the virus appears to meet the statutory definition of a biological agent. Therefore, Rosen wrote, such acts potentially could implicate the nation's terrorism-related statutes. Authorities in multiple states, including Illinois, New Jersey, and Missouri, have reported instances of people claiming they were infected and intentionally coughing on others or licking store items. The Justice Department is also cracking down on scammers trying to profit off the pandemic through illegal methods like price fixing or bid rigging.
Now we know how serious of a pandemic it has become, and I know a lot of you have seen the one particular graph all over the internet. But what does flattening the curve actually mean? Let's find out together.
You've probably been told to stay indoors, limit contact, and go outside only for essential activities. All because of this curve.
Flatten the curve.
The curve.
The curve.
This curve.
Flattening the curve.
It shows the hypothetical number of cases in a pandemic over time, without an intervention and with an intervention. The dotted line represents the capacity of hospitals and healthcare systems. If social distancing goes well, this curve will be flattened, allowing hospitals to take in and discharge patients without being overwhelmed. The result? More people will get access to the healthcare and attention they need, and hopefully, fewer people will die. But the x-axis represents time since the first case. If you lower the peak, the pandemic might last longer, because the number of new cases will be spread out over a longer period of time. But the question on a lot of people's minds is exactly how long will that be? Right now, the world is trying to both flatten and shorten the curve, fewer cases and a shorter outbreak. But to do that, we might need to live like this for a while.
Now, during this pandemic, we are all in isolation and in quarantine, and we should stay indoors. But what does physical and social distancing actually means? Now, a lot of experts look at the value of R0. What R0 actually means, let's find out.
So that's basically the average number of people that one sick person can go on to infect in a group that has no immunity to a virus.
The R0 of the coronavirus is thought to be between 2 and 2.5. That means that each person with the virus could infect about 2.2 other people.
And we also believe that it is possible for people to be spreading this disease even before they're feeling sick. So we call that pre-symptomatic transmission. So all that taken together means that this thing spreads quite quickly and sometimes silently.
For comparison, the R0 of the flu is about 1.3. 1.3 sounds close to 2.2, but the difference can be huge. Someone with the flu might pass it on to dozens of people, but someone with the coronavirus might indirectly pass it on.
Now, as you can see, it doesn't take a lot for someone to get it infected, especially elderly people, young children, and people with low or compromised immunity. Now, this can further lead to something called two-step social distancing. Now, we all understand we are following social and physical distancing right now, but the way to flatten the curve, it could lead to a point where we are social distancing right now, we go back to work, get back to our normal daily lives, and then a second wave of social distancing starts.
We start letting people go back to work, go back to school, and then once that happens, the virus would have an opportunity to spread again, and there would be a second wave of infection.
If we end social distancing too soon, new cases could pop up, and we could end up in another curve, again. If the number of reported cases spikes again, we might have to enact the same policies we have in place now, which might be stressful to hear, but it's important to stay calm and follow the advice of healthcare professionals.
When you take measures to prevent yourself from getting infected or spreading the disease to others, you may be indirectly saving other people's lives.
Now, the world's biggest democracy with a population of 1.2 billion in India, Indian Prime Minister has finally announced a 21-day lockdown. But he didn't announce it in a very fashionable way. He announced it 4 hours before the lockdown went into play. Take a look.
World's largest COVID-19 lockdown is now in effect for India's more than 1.3 billion people. The Indian Prime Minister giving just 4 hours notice until the lockdown came into effect overnight, saying nobody will be allowed to leave their homes for the next 3 weeks to break the cycle of coronavirus infection. Police barricaded roads to restrict movement. The government had already shut down all air and train travel, businesses and schools. The new sweeping lockdown ordered as India confirmed roughly 500 COVID-19 cases, but the real number is likely much higher. Testing is limited, and health experts warn the densely populated country could face an explosion of infections. The country's public health system is already strapped for resources, with far fewer hospital beds than Italy, one of the country's outbreak epicenters. Stores selling food, along with other essential services, do remain open. And while people are being told to leave their home only if absolutely necessary, the ban hasn't stopped crowds from rushing to markets to stock up. Some are risking fines and other penalties for violating the lockdown. Police also enforcing the ban with violence and ordering push-ups as punishment.
Now the cops actually punishing people by having them do push-ups and sit-ups. I mean, people are gonna get really fit in India because you can see everyone walking around, going to the grocery stores. So I can see people being really fit in India after the lockdown's done.
But there is help going out to the poor and daily wage earners who don't have the resources to stock up supplies, with officials handing out free food to those in need.
Now we've seen so many fake posts on Facebook, messages being sent on WhatsApp, different texts being sent around, different Facebook and Instagram posts, but not all of them are true. So today's deep dive segment, let's break down some of those myths.
They seem helpful, viral posts full of advice on how to treat coronavirus, how to kill coronavirus, even how to test for coronavirus. The problem? Many of them simply aren't true. Like this viral post claiming drinking water every 15 minutes will flush the virus into your stomach, where acid will kill it. The truth?
So that myth doesn't really pan out because it's more of a digestive answer for a respiratory problem.
Another viral post claims specifically drinking warm water is effective against the virus.
I think that people have come up with this possibility because there has been some discussion over the virus replicating in our throats. But again, this virus is a respiratory virus.
Instead of drinking water, this post falsely claims gargling with salt water or vinegar eliminates the virus.
Short answer is no. But I found that people who have sore throats, which can be a symptom of the COVID-19 virus, find that this helps relieve their sore throats. And if that's the case, go for it.
Some on YouTube suggest drinking Miracle Mineral Solution, or MMS, which the FDA says, when prepared as instructed, becomes chlorine dioxide.
Chlorine dioxide kills every pathogen, every virus, including the coronavirus.
But the FDA warns ingesting these products is the same as drinking bleach and has caused serious and potentially life-threatening side effects.
That's where I draw the line, buddy.
What if you just want to know if you have the virus? One post mentions you must have a dry cough and no runny nose. But our own Kaylee Hartung, who tested positive for the virus, explains that's also not true.
It really all started with a runny nose about a week ago, and that was 4 days after I'd returned from a week spent in Seattle. What was notable to me was that I wasn't having the symptoms that were being so closely associated with coronavirus. I wasn't having any sort of a dry cough, I didn't have any shortness of breath, and I didn't feel any pressure on my chest. So it was easy for me at first to think, this is nothing. This is not something to be concerned about.
As an emergency physician, I've seen people come in with all types of symptoms, including lack of smell, diarrhea. So the short answer is each person will probably have different symptoms to the COVID-19 virus, many of which will probably be mild.
Another post falsely claims you're not infected if you can hold your breath for more than 10 seconds without coughing.
Only some patients are presenting with a cough. So I would advise people not to hold their breath. If you find that you have symptoms that are similar to a flu or a cold, at this point in time, just assume that you have COVID-19 and self-isolate yourself.
Whenever possible, get your info from a vetted medical source like the CDC, World Health Organization, or the National Institutes of Health. One more thing you can do is check the supposed source of the information. One of the posts we mentioned claims to come from Stanford Hospital, but if you go to Stanford's Facebook page, you see this message. The post did not come from Stanford Medicine. So if you have questions about COVID-19, go straight to a reputable source or ask your doctor.
There are a lot of fake posts going around, so make sure you do your research when you read these posts. And if you have any symptoms, please go get tested if you can, or take a doctor's opinion. Stay safe, folks. Stay at home and practice social and physical distancing. So that was it for the quarantine edition of Diving In this week. Make sure you like, subscribe, and comment. I would love some feedback from this video. As you can see, this video I did change my layout a little bit. So let me hear your feedback, and thank you so much.